Dzień dobry Państwu.
Ladies and gentlemen, good morning and welcome. Welcome to Akademia Motywacji i Edukacji. This is yet another excellent seminar for Ukraine, Army for Ukraine. So once again, we have the pleasure of having here our outstanding friend straight from Australia, Dr. Babak Najand. And we are very happy to have you. And we are very happy to have the opportunity today to work clinically together. Babak has agreed to do this last time. You know, I had myself the occasion to actually act as a patient, as a client, and it was a really instructive experience for you as the attendees, but also I can say on my part that as a clinicist, you know, that for me was very helpful. And actually, I invite you to share your clinical cases, and we encourage you to actively join into this conversation. We encourage you to actually present your cases involving work with people who have experienced all sorts of traumatic situations faced of the war in Ukraine, and hopefully we will be able to watch this together, observe work in the cognitive behavioral approach in terms of helping people who suffer from PTSD. So we do encourage you, and we know that among the attendees we have people who are ready to actually work with us and present their cases here before us, and we do encourage you to write this in our chat, and we will seek to give the panelists privileges to you and work with Babak here. So let us give the floor to our guests now to outline and introduce the whole meeting and tell us about the agenda. Babak, the floor is yours.
I'm ready. Okay, starting.
Yes.
Okay, good morning, colleagues. As Anna kindly said, I'm Dr. Babak Najand, cognitive behavior therapist, one of the certified CBT therapists from Academy of Cognitive Behavior Therapy. I'm based in Brisbane, Australia. Those who were in the previous session most probably knew that these sessions that I'm holding would have the structure of mini workshops. That means it's mainly role play. This is the role that I thought defining that for myself would be more helpful, as my other senior colleagues would explain lots of things about the theoretical aspects of cognitive behavior therapy of trauma. I think with all of these things happening, all of these crimes happening against Ukrainian people, we are all more clear about the huge aspects of the disaster, and unfortunately, everybody expects the dimensions of disaster to be even more than this. Therefore, I'm sure that all of us are aware of the importance of cognitive behavior therapy of trauma patients. Especially, I have read all of these horrible reports about the Ukrainian people being sexually assaulted by Russian soldiers, therefore, based on the cases that are presenting to me today, I tried my best to cover all of the aspects of the most important techniques, how to challenge negative automatic thoughts and how to elicit cognitive errors, helping the patient, the client, to understand cognitive distortions and the importance of them. In the previous session, we worked on how to elicit negative automatic thoughts and negative emotions. And those of you who were not in that session, I encourage you to watch that session. I understand that the links and the records are available by our colleagues, and I would probably be able to help with those of you who haven't been in that session or haven't watched that. And then, based on that session, challenging negative automatic thoughts by some of these techniques would be more meaningful. So the way it works is I start role play. So we'll jump to role play straight away by a candidate, one of you colleagues who is willing to present a case related to trauma and hopefully war trauma, something related to all of these miseries that people would have all around Ukraine. And while doing that role play, as we did last time, I'm going to explain what I'm doing, the technique, how you'd use it, and some of the bits and pieces around the technique and some of the roadblocks whenever it happens based on the case. It's a very dynamic thing. So because I don't know the case, and it is beautiful when I don't know the case, everything happens real time. And I believe, to my experience, this is the best way for all of you to have a better understanding of the technique. It doesn't have any benefit for you that I come here and play or do a role play that I've already practiced with somebody. It is helpful when you see how you overcome the real-time challenges when a therapist is dealing with a case that he doesn't know. So that's how we go forward. Okay, I'm ready for a brave person who comes forward with a case. Anna, at your service. Who is the
Tak, super, bardzo dziękujemy.
Yes, great. Thank you very much. I see that we have Sofia Gladiuk, who has volunteered, and that's great. Thank you, Sofia. Thank you very much. Already at this point, and Przemek, could we get Sofia here promoted as panelist so that she can? Yes, Sofia has already obtained the promotion to panelist, so.
Okay, so who is the candidate, the colleague?
Pani Sofia, bardzo serdecznie witamy.
Sofia, hello.
Dobrego dnia.
Hi.
Jak mnie słyszycie?
Hello. Everybody can hear me?
Bardzo dobrze.
What's the name of the colleague? Sorry, I'm waiting for your lead. Whenever you think it's okay, I'm going to
Добре.
start.
Отож, я можу розказати про свого пацієнта. Він має 39 років. Це чоловік, який...
Well, I'll tell you about my patient. He's 39 years old, and he's a soldier who has been fighting since 2014. And he was part of the airborne division of the. And now, what is his problem? He ended up in our hospital, in our military hospital, and before that,
Місяць часу до того він перестав вживати алкоголь, а то в нього був десь
well, a month before that,
коли він вживав алкоголь. А причина, яку він повідомив, це розлучення із дружиною, заборона дружини спілкуватися з дитиною.
well, he was using alcohol for a month, but earlier, okay, half a year earlier, 6 months earlier, he started drinking because he'd split with his wife and he didn't have contact with his kid.
В поселенні поряд того міста, де він жив. Ось, і,
He lost his house, so he was a homeless
його
person.
батько,
Sorry. For some reason, I was not on English interpretation, so unfortunately, I didn't get the case. Can I just changed the setting now. Now I can hear the interpretation. Can I kindly ask you to start again?
Чи я правильно...
Yep. Very sorry.
Так, гаразд. Отож, я хотіла би представити свого пацієнта, йому 39 років. Це чоловік, який воював з 2014 року у десантних військах.
So the story is as follows. My patient is 39 years old, and since 2014, he has been a soldier fighting in the war, and he ended up in our hospital. And basically for half a year, he'd been drinking heavily because he
Sorry.
divorced his wife
Sorry.
and he lost.
Since when has he been drinking?
Він пив півроку, але перед тим, як до нас приїхати, він десь місяць-півтора він не пив.
So for half a year, he'd been drinking heavily. But when he ended up in a hospital, well, by that time, he'd already quit. For a couple of days, at least, he hadn't been drinking.
Він втратив роботу. До війни він працював банківським працівником.
He'd lost his job. Before the war, he'd worked at a bank. He'd lost his flat.
Був на ти із цифрами. Коли він повертався, пробував...
And he'd been really proficient in mathematics before. And he started to, he wanted to come back to his profession in the banking, but he failed. And he started working as a laborer, as a physical worker in metallurgy. So a blue-collar job. It's a short story, really, to introduce the case. Well, the symptoms. Let's talk about the symptoms now. Well, he still has them, by the way. He complained about being you know, harmed by fate, that he had no support in his family, that he was a sick person, alien person, and that was his story. And so he also cried.
Лишаються якісь певні осколки в нього в тілі, щось забралося, щось ще лишається. Він дуже погано спить, тобто одна...
So basically he
власне, це те, що і для оточуючих навіть заважає.
He already had fragments of shrapnels in his body, but some had been removed, but some he still has in his body. He has nightmares, he screams in his sleep, and he is restless, and his dreams are very turbulent, and he tends to wake up at night, or he can even fall out of his bed sometimes. And the diagnosis? Well, lack of the possibility to adapt. So adaptational dysfunction. And he'd been treated at psychiatric hospitals, and he'd been having attacks for half a year, basically. So, but in our hospital, no such attacks. But beforehand, he'd had them. So I worked with him initially. We talked about existential matters, but then the direction of therapy was, you know, prolonged exposure and work in the body to stabilize the patient and grounding. And he talked about his memories, what he recollected, and they were about his combat experiences.
Okay.
So that is what we can consider most traumatic about this.
Yeah. Can I interrupt you? So thank you. I think all of us now know a bit about the patient. Now, I'm going to start role play. For that purpose, you would be the patient. You can choose a name for the patient, whatever name you think is appropriate. And this setting is, I'm therapist, so we know each other. We have had some sessions. I don't need to start again. In this session today, I'm going to talk about one of your traumatic experiences that you had from war area or war field, and we elaborate on that. Quickly, we elicit negative automatic thoughts, and then after that, we are going to use some of the techniques. So we would be in role play all the time. You would be the patient, and you can ask. You can answer my questions based on the experiences that you have about your patient. Obviously, you know the patient, and whenever necessary, I stop the role play and I explain some of the things for all of the participants. Now, if you agree, we start the role play. Is that okay? Okay.
Yes.
So based on that, what is your name, the name of the patient?
Сергій.
Sorry?
Сергій.
Сергій.
Sihi. Okay. Okay. So Sihi, today we're going to go through some of your, one of your traumatic experiences that you had in a war zone. It might be disturbing for you, but I can reassure you, I'm with you all the time and you're safe. Do you feel safe to talk about one of those very disturbing traumatic experiences?
Magda,
możesz powtórzyć?
I'm making, yeah.
Can you repeat, please?
Yes. So, Sihi, today I'm going to start talking about one of those traumatic experiences that you had in the field of war. I understand that it can be very, very disconcerting for you. However, I can reassure you that I'll be with you, supporting you all the time. Is that okay if we start talking about one of those experiences?
Можемо.
Okay. So, see, if you want to focus on one specific, one particular experience, what was one of them which was very much traumatizing? One of those that you experience, you have nightmares about?
То був випадок, коли я 4 дні ходив із своїм товаришем, якому відірвало ногу. Ми ходили по місцевості, ми не могли зорієнтуватися і боялися дуже десь кудись виходити, аби не потрапити в руки сепаратистів, в руки російських військових. І через це ми так дуже обережно рухалися, і я носив постійно його ногу з собою. Ну все, це цей випадок такий. Я не знав, що тоді не можна було носити ту ногу, ну, я її постійно з собою носив.
Okay.
I'm sorry, I had a problem with the channel.
Hello. Sorry, I didn't hear.
Yes, I didn't hear the interpretation for some technical reason. I will have to ask Sophia to repeat. I'm sorry.
It's fine. Okay.
Okay, so the point is that that soldier Serhi was with his colleague, and they had this leg. They didn't know where to actually go. They didn't know where the Russian soldiers were, and Serhi was leading this colleague, this fellow soldier with this leg, and they were carrying this leg. They didn't know that it was unnecessary. They were carrying this leg that had been torn off simply.
Okay. Say, can you tell me the whole situation, this traumatic event, how long did it last from the beginning to the end? This is the part that you experience over and over again.
Не розумію. Що саме треба уточнити? 4 дні.
Well, I understand. Well, okay, 4 days. 4 days. It lasted 4 days.
Yeah. Okay. So see, now that you're thinking about that incident, and during all of these re-experiences that you have, what is your main feeling, emotion? Do you think you're sad? Do you think of it as an anxiety provoking thing, or it makes you angry? Which one do you think?
Тоді це було дуже багато страху.
Well, at that time, there was a lot of fear, mainly. We didn't know where to go.
What about now?
And which direction to choose so as not to end up in Russian hands.
What about now? What do you
Зараз,
feel?
коли згадую, це дуже неприємно. Це також десь
It
піднімає.
was all, these are unpleasant memories, and the emotion of fear keeps coming back, you know, the fear accompanying me, it keeps coming back, these feelings.
Okay. So see, when we are fearful, that means we think about future. That means we think there might be some reasons to be fearful again for future. Isn't it right?
Цей страх, він
This fear
виникає сам по собі, коли згадую про ту ситуацію. І воно якось
results from, well, it's automatic. Whenever I think about this situation, when I think back on that situation, it consists in, you know, feeling it with my body.
Yeah. Now that you are talking right now, do you still
O czym
think
pani
there might
mówi?
be a risk for you?
Зараз ні.
Well, not now, no.
Mhm. So in that case, what do you think of the reason that you feel fear, as it was for the past time, not for now?
Можливо, то думка, що не справлюсь.
Well, possibly,
Можливо, це думка, що не справлюсь. Що не знаю, як.
I simply think that I won't be able to cope. I don't know how I will cope with it.
With what happened in the past, or with the feeling that you have right now? Which one?
Це було і в минулому, це і є.
Well, currently, because it was, back then in the past, but it's also here now.
Okay. So right now, do you think because of what happened in the past, something is missing in your life?
Ну, зараз багато чого не вистачає. Я вже тепер не такий, як раніше був.
There are many things I'm lacking now, it's not like before.
Mhm.
Якщо я раніше дуже любив цифри, то я тепер мені важко рахувати.
Earlier, I used to love numbers, but now I can't even count to 100.
Mhm. So, if you want to tell me the exact reasons that you think you've lost your life over what happened in the past, what sort of things do you think you have lost in your life right now because of that traumatic incident?
Впевненість в собі.
Well, self-confidence.
Mhm. What does it mean, self-confidence? When you're saying that you've lost your self-confidence, what's your definition of self-confidence?
Я знав, що я хочу.
I knew what I wanted.
Шляхами я рухаюсь.
Mhm.
I knew how, to go about it, which road to pursue. I knew what I was doing. Now it's not there. I don't know what to do.
Okay, so you don't know what you want in your life?
Зараз моя така мета це, мабуть, знайти
Now my
жінку,
goal,
яка би могла би мене підтримати.
it's to find a woman who could support me and can guide me. I need someone.
Okay, so you are saying that I'm emotionally lonely. Is that correct? Is that what you're talking about?
Так.
Yes, exactly.
Okay, what I did so far was first, I tried to help the patient to acknowledge what sort of negative feelings he has. In this case, see, he is a male, I'm assuming, and came out that even though part of the issue is anxiety, the major part that he is dealing with right now is sadness. I haven't still elaborated on that. This is just an explanation for you how I did that. So what, as a therapist, I need to understand first is walking with my patient's shoes, is understanding what my patient is suffering from first. What I can see right now is that this patient is suffering from losses in his life, like the bits and pieces, the remnants of that hurricane in his life. At least this is what he is saying. Now, the next step was when he said, I have lost my self-confidence. That didn't satisfy me because each person would have a separate definition from self-confidence. So I asked him, what do you mean by self-confidence? I wanted to understand the meaning for Sihi. And very soon he said, I mean, I don't have a woman in my life to support me. That means loss of emotional support, loss of love. which is related to hope. Okay, I pinpointed the matter and he confirmed what I thought was the main problem. Okay, so yes, I say he don't have emotional support. I am emotionally lonely. So what I did was defining the terms, one of the techniques, very important, even before doing anything else. You need to pinpoint what your patient means by a specific term, because the patients can be extensively variant and diverse with regards to what they interpret of a specific term, like self-confidence. Another person might use it in his job, but for this man, it meant self-confidence in finding a secure emotional relationship. So defining the terms or semantic analysis. It is also very essential to do semantic analysis or defining the term when you want to challenge a negative or traumatic thought with evidence technique. Because you can't help the patient to challenge a negative or traumatic thought if you don't know what he meant by a specific term. Now, let's continue. Okay, say he. Thank you. So far, I know that you're saying that I'm emotionally lonely. Is that correct?
Так.
Okay. Now, other than that, what else have you lost due to that incident? What else is missing in your life and is getting you troubled?
Немає роботи.
Well, I don't have a job.
Okay. And why is it important? Excuse me to ask, because everybody can be can be distressed by something for specific reason. What is your reason to be distressed but not having a job?
Я не маю кошти на якісь такі
I don't have money
потреби.
to buy some basic staples, really, to satisfy my basic needs. I'm very sad and I'm ashamed. I'm embarrassed that my parents have to help me. Money for my credit card bill, my father gives me that cash. So this is something that really depresses me, and I'm simply ashamed. I'm supposed to support my parents, not the other way around. My parents are very important to me.
Yeah. It is completely understandable. It can be quite distressing and very saddening being in such a situation. I can only imagine being in such a situation.
Я є єдиним сином, який може зараз батьків.
I am the only son,
Mm-hmm.
and well, it would be my job to actually maintain my family, and they are currently in an area that's been bombed, and I wanted to convince my parents to come over, but my mother doesn't want to leave. She can hardly move. She doesn't like to travel, you know. She doesn't want to leave her home.
Mm-hmm.
And my big brother died. He was killed, and the other one is in an area controlled by the Russians, you know, since 2014, by the way. So So we have no contact with him. So I am effectively the only son because I'm the only son left, effectively. So I can't help it. I can't do anything about it. Because I need help myself, really, unfortunately.
It is totally understandable. And I can't say how much I'm sorry for the situation. At the same time, I believe I can help you. How? How about this? If we focus on you and getting you better, so you can take those measures which are necessary to help your family one by one. First of all, your parents, after getting on your feet again. How about that? How do you feel about it?
Якщо я буду мати нову сім'ю.
Well, if I have a new family.
Okay. So what I did was, you see, in the middle of a cognitive behavior therapy session, every now and then, especially for trauma patients, you need to be supportive. You need to reassure the patients, but at the same time, reassurance should be very realistic. You can't reassure that you can, for example, fix all the issues that he has, but you can say, well, let's get you on your feet again, which is something within your power to help him about it. And then let's go back to the board. So, Sihi, so far, I have found 3 thoughts in your mind. Let's choose one of them to work on. First of all, you said, I'm emotionally lonely. Second, you said, I'm financially in trouble. And third, you said, I'm ashamed in front of my parents as I'm getting help from them. Which one of these 3 do you want to work on?
Соромно перед батьками.
The shame I feel confronted with my parents. I'm ashamed, you know, in front of my parents.
Which is totally understandable. For a proud man like you, it should be very staggering and pressurizing, feeling shame. Okay. As you can see, the fact that you're going to treat the patient doesn't mean that you should oppose all of the patient's concepts. For example, it would be very unprofessional, and I'm sure all of you would know that. It would be very unprofessional to say, oh, look, you don't need to feel shame about it. They have the duty of supporting you. This is very unprofessional because it's how he feels. So first of all, acknowledging the feeling, then going forward and trying to address the grief of being dependent to the parents. Okay, let's go back and work on that. Just one more thing that I need to explain. As you can see, we want to find one negative automatic thought and start using other techniques for that. In a proper treatment course, we usually use our time to elaborate and extract all of the negative automatic thoughts. In such a patient, there will be plenty of thoughts related to the field of anxiety, because the patient would have anxiety for future, anxiety of, for example, what if I realize that my other family members, siblings are dead? What if I have to deal with the issue of losing my parents again? What if I experience the war situation again around me, or these kind of things? At the same time, such a patient would experience anger towards Russians, anger towards himself, and even anger towards, for example, some politicians or whatever. But the most important part of anger in trauma patients usually is towards him or herself. The reason? There's always a tendency of guilt feeling in trauma patients. Therefore, you need to extract negative automatic thoughts related to anger towards him or herself. Assuming that it was my fault, I put myself in such a situation. I didn't have enough ability to manage the situation. On that specific day, I predicted the risks inappropriately and all these kind of things. Therefore, this is the part of anger. And then after that, sadness. You know, we have three negative emotions: anger, anxiety, and sadness. And this is your lead to extract all of these feelings. As you can see, this patient, Sihi, preferred to start with sadness. It is mostly because he is a case of chronic trauma. And chronic trauma, in majority of the cases, would end into a deep depression. This is what we can see with Sihi. He's deep down depressed. So depression is the scene after the hurricane. All of these hurricanes in his life has demolished so many things, and now he's sad. Sadness means loss. We have followed the trail of his thoughts to sadness. So in a thorough treatment of a patient, first you need to recognize all of these aspects: anger, anxiety, sadness, and negative automatic thoughts related to them. In this session, I didn't go there. I didn't check negative automatic thoughts related to anger and anxiety. We did that in the previous session because I wanted to have time to work on negative automatic thoughts. So I stick to the last one, and we continue challenging the negative automatic thought for the patients. Okay, Sihi, are you ready to talk about this, the one that you said? I'm ashamed in front of my parents.
Так. Так.
Okay, good. So,
Yes, I'm ready.
Okay. And I understand that this shame is because you're financially dependent to them. Is that correct?
Так.
Yes, that's correct.
So now that, and what's been their type of communication with you? Do they seem happy to help you, or they are mad at you because of being financially dependent to them?
Вони мене дуже люблять.
My parents love me very much.
Okay. And what they provide for you, is that enough for your immediate needs in your life?
Could you repeat the last
Yeah.
sentence, please?
What they give you, the money that they give you, is that enough for your essential needs in life?
Не вони мають робити, а це я маю їм допомогти.
No. They are not the ones who should be supporting me. I should be the one supporting them.
Пенсіонери, вони хворі, вони використовують кошти для себе.
They are retired, they are sick, ailing. They lack the money to actually cover their needs. And then there's also me on top of all that with my needs.
Yeah. And that is very disturbing for you. Now, the fact that they are supporting you financially, what does it mean? What's the reason it ashames you?
Я тоді згадую той період, коли я там 20-літня.
Well, I'm looking back on that period when I was 20, 25. I bought a flat, 3-bedroom flat. I could afford anything at that time, when I was younger, but now I can't afford that. I simply can't afford it.
Yeah. And the fact that they are providing for you, what is the reason that you're ashamed by that? What does it mean that you're dependent? Which part of that is very bad for you? Does it say something negative about you?
Бо так не має бути.
Well, it shouldn't be like that.
Це говорить про те, що неспроможний. І так не має бути.
Well, things shouldn't be like this. I can't do anything about it, and that's bad.
Well, you said you're ashamed. When a person is ashamed, that means that person feels guilt. The fact that you're guilty or you feel guilt about yourself means you're what? What's the label that you put on yourself? Because you said you're ashamed, so I'm assuming you're labeling yourself as something.
Неспроможний, нездара.
Well, a person who can't do anything, is incapable, a good for nothing.
So that means you feel guilt because of being incapable of doing something?
Угу.
Okay. So,
Yes.
okay. Now I used another technique. This technique is downward arrow technique. Downward arrow technique is when you want to know the depth of a negative automatic thought. Sometimes when the negative automatic thought is very, very vague, you need to elaborate on that. You need to get to the bottom of the thought before starting challenging your thoughts. So challenging a negative automatic thought without without digging to the bottom of that, it would be a trap for you. Because when this person says, I'm ashamed in front of my parents, you don't know the reason he feels ashamed. He might be feeling ashamed for lots of reasons. So you're saying that, okay, you're ashamed. What does it mean? You're ashamed. What does it mean? You're ashamed, so you feel guilt. You feel guilt. What does it mean to you? What is the label? As you can see, I went down and down and down. I tried to understand the exact reason. At the end, I helped him. Okay, because I saw that he was not able to pinpoint the reason for his shame, I helped him. Okay, you feel ashamed, so that means you feel guilt? Okay, now that you feel guilt, because you have a label on yourself, and at each step, I asked the patient's confirmation. I wanted to make sure that I'm going to a right step. So either your patient tells you what he feels when you're using downward arrow, when you're digging, either he would tell you about that, or you would confirm with him what you think is the reason. So this was what I did. So we came to the conclusion that he's saying that I feel ashamed because I'm incapable. Okay, Sihi, would you agree to talk about this? As far as I understand, you're saying if a person is incapable because of war trauma, that person should be criticized for his incapability. Is that what you think?
Очевидно, так.
Yeah, I believe so. Yes, I do believe so.
Okay. Now, let's see what I did. If I wanted to challenge the first thought, I'm ashamed in front of my parents because of being dependent, and I wanted to challenge this thought, it would have been very difficult because he would have been able to defend this thought. Look, doctor, sorry, you would be ashamed too if you were dependent to your parents the age of 39. So it would be very difficult. However, what I did as a therapist, I asked myself, what is the reason that instead of changing the situation, this young man is criticizing himself? So I digged into that and I went to the bottom of that, and I realized there was an intermediate belief or an assumption. So obviously he assumes that if I am incapable because of this trauma, I should be ashamed of myself or I'm guilty. That's the assumption that I found. Okay, now this is the one that I can challenge with evidence technique. I'm going to move forward and challenge it with evidence technique. However, before that, I just need to ask something from Anna. Anna, do you want a break or we should continue? I'm more than happy to continue.
Myślę sobie, jeśli
Yes, I think if I may, yes, let's take five. Let's take five. Okay, a technical break just for whatever people want to do. 5 minutes.
Okay, okay.
Dzięki bardzo.
5
you.
minutes.
Okay. Zapraszamy. We can continue.
Yes.
Fantastic.
Hey. Okay, Sihi, I hope you have a pen and paper with you. Good. So I understand that you have an assumption about yourself. You're saying that if I'm traumatized and incapable, it is my guilt. Is that correct? This is my fault.
Tak, tak.
Okay.
Yes.
Now,
Yes.
I'm going to ask you to create 2 columns, one for all of the reasons that would prove that this is a case, all the reasons that would say that this is a correct statement, and the other would be all of the reasons against this statement, the reasons that would prove that this statement is incorrect. Can you please do it for me? And please, whatever you write, say it loudly for me.
Це твердження, які будуть стосуватися взагалом всього мого життя, чи минулого, чи...
Okay, these statements, are they supposed to be about my whole life, my past, my future, or the present?
Well, I'll stick to your interpretation. So it depends to what you think. So far, I understand that you're ashamed in front of your parents. You think you're guilty because you are incapable due to that trauma. That means, I checked that with you, you said, that means because I am traumatized and incapable, I am guilty. It is my fault in front of them. That was what I understood from your explanation. Now, whatever it means to you, you can write all the reasons supporting this statement. There might be some, or there should be some reasons that you believe you came to this belief that this is the case. You should be ashamed in front of your parents because due to the trauma, you're incapable. If that's the case, there should be some reasons. Please write all of the reasons in one side.
Добре.
Okay.
Can you tell me whatever you're writing,
Пишу те, що підтверджує, що така є ситуація, те, що я відчуваю неспроможним себе. І тут є вже, я так чітко можу сказати, що
Well, I'm writing about what makes me feel incapable. Well, the first thing is my physical condition, the pains in my leg, my headaches. I have problems with my memory.
So your physical condition and your mental cognition, these two things, your brain, how you're traumatized with your brain and thinking, is that what you're saying?
так.
So these two things so far. And what else? What else would prove
Те, що
that
немає роботи.
it's your fault?
Well, that I don't have a job, that I'm unemployed.
What else? So far, we've extracted 3 reasons for you to feel guilt and shame in front of your parents. Is there anything else, or you want to write the other column, the reason against?
Я ще згадую про
Well, I can recall
моєї колишньої дружини спілкуватися.
this prohibition. I can see my child. Well, my wife actually doesn't allow me to meet with my kids. So I want to stay in touch with my son, but my wife prohibits me from doing that. And this shows me maybe she believes that I would have a bad influence on the kid. I would give him a bad example.
Well, and is that one of the reasons that you should be ashamed in front of your parents?
Yes.
Okay.
I believe that it might be the case.
Okay, so the fourth one, the fact that my wife rejected me. And what's her worries? What's the reason she thinks you might have a bad influence on the kids? What would you do in her mind?
Ну, перше, те, що
Well, above all,
поведінка, вона дуже лякає.
I'm cynical. And this attitude, well, you know, it's horrible. And I'm sometimes kind of abrupt.
Я так на хвильку зроблю таку ремарку. Я пам'ятаю, що Сергій розказував про той випадок, коли він був небезпечний для дитини і для дружини.
And I remember, I'm speaking as a therapist now, that there were some situations in which Serhi would be abrupt or violent even, and
Okay.
And so he posed a threat to the child even.
Okay. So let's continue the role play. Sihi, were you cynical and abrupt before all of these traumas in your previous life, before all of these things happened?
Ні, я дуже хотів дитину, я був на самому народженні дитини, я дуже хотів цього сина, у нас були добрі стосунки.
I wanted my son to be born. We delivered together. I was there, I was a great husband. I could take care of my family. Everything was fine.
Я міг багато чого дозволити собі, дружині.
Okay. Now,
I could
Thank you.
afford a lot.
Yeah.
Not only when it comes to me, but my family, the whole family could afford a lot.
okay. Thank you. And now, do we have anything in the other column, any reasons that can prove against it, that can prove that none of these are your faults and you shouldn't be ashamed because of these things? Is there any reasons against that?
Ну так, я не контролюю свою поведінку під час сну. Так, я дуже голосно кричу, так, я зриваюся, це я не контролюю. Я
Yes,
не
I can't control my
те, що
behavior during sleep.
з пам'яттю в мене так погано.
I sometimes burst out, scream, and problems with memory, well, it's also not my, it's involuntary.
So the first one is, during sleep, my behaviors are involuntary. Okay, what's the next one? What else can you say in this part? As you can see, we try to ask the client open questions first. So before suggesting anything, we don't want to rush into suggesting something. First, we ask the client to think about finding evidence against.
Те, що я дуже різкий в своїй поведінці, тобто, якщо я щось...
I'm also kind of hot-headed and rough, when I'm...
Якийсь жест, якийсь рух в мою сторону як небезпечний, я можу бути дуже небезпечним. Якщо я щось є таке...
When I see that something threatens me, some action or someone, performs a movement, I tend to react abruptly, and I can also be dangerous in this situation to others because I know martial arts and, relying on my combat experience, I can pose a threat for those people.
And does it have anything to do with your shame and guilt, positive or negative? Does it prove that you should be shameful, or on the other side, it shows that you shouldn't be shameful?
Ну, це неможливість контролювати себе.
It's the inability to control myself.
Okay, so now you're talking about part of your mental symptoms related to your incapability. Is that correct? So one of the reasons was mental incapability. We have already written that in the evidence for, in the side of the reasons that would prove. So it's part of that. We still have 4 reasons proving that your statement is correct, that you should be shameful and you're guilty. Part of that you explained was related to the mental incapabilities that you have. Is that correct?
Так, так.
Yes,
As
yes,
you-
exactly.
As you can see, your patients may say lots of things, and thank you for this case. This is exactly what we can see in complex trauma cases. The patient would say lots of things, not necessarily in the direction that you're asking him or her. Sometimes it is our duty to categorize what he's saying. For example, now he was going to put forward a reason against this statement, but in effect, he said something related to the other side, something proving that his incapability is related to shame and guilt, and he should be shameful. I helped him to understand that, okay, this belongs to that part and goes to the mental incapability. This actually is part of the treatment because it helps the patient to have a metacognition, to have an understanding of his own feelings and thoughts, to understand which is which, to categorizing the thoughts. It's very important. So while you're doing evidence technique, you're still doing some other things. You're helping the patient to understand the structure of his mind. As you can see, the power of negative thoughts are so strong that when he wants to bring reasons that he shouldn't be guilty, he's still giving some reasons that he should be guilty. He talks about his abruptness and aggression and threatening tendencies. Now, do we have any other reasons, Sihi, showing that you shouldn't be guilty, you shouldn't be ashamed because of these incapabilities? Is there any reasons?
Ну, я зараз собі подумав.
Well, I've been thinking now.
Я не соромлюсь
That it's not that I'm ashamed
того, що я пішов у військо і
of
захищав країну.
of having defended my homeland, of actually entering the ranks of the military. I'm not ashamed of that.
Що я пробував знайти ту роботу, яка, я маю
I actually tried to find a job. I have, education, but I'm not ashamed that I went, I chose a job as a kind of, contractor just to get the money to support my family. But unfortunately, I failed.
Okay. So
I'm not
just
afraid of work,
Yeah. So you mentioned two important things, Sihi, and that's very exciting. You said, I fought for my country, and I shouldn't be ashamed for fighting for my country. Let's write it down. And second of all, you said that I have tried to have a job. So against the other side, something about being jobless, you said, I have tried and I'm not afraid of having a job. So Rick, let's write it down as well. Okay, so far I've written 3 in this side. During the sleep, my actions are not under my control. That's the first one you said. Second one, I fought for my country. I shouldn't be ashamed for that. And third, I'm not afraid of having a job and I've tried. Okay, what else can you say, if there's any, against this? Whatever proves that you shouldn't be ashamed or feel guilty for these problems. It's okay if you can't remember anything. That's fine. Just tell me.
Я зараз згадав про те, що
Now I actually remember something that when we were getting divorced, because there was this decision, you know, about the flat where my kid was living and my ex-wife, you know, I left everything to them. I simply, you know, left everything there. I simply couldn't, you know, I was in such a bad state, you know, I couldn't come to my parents, so I was homeless. I didn't go straight to my parents in that state, but I'd left everything to my ex-wife and my kid.
Okay. So you're saying one of the main reasons that you are in such a situation right now is because of your generosity. And your generosity argues against your shame and guilt. Is that correct? Okay, let's write it down.
Yes.
As you can see, this is the value of asking open questions and insisting on that, because whatever your patient answers in response to open questions is very genuine, very important. It is more important than what you can speculate. If you ask, okay, do you have anything? And this is a right moment to ask that, because your patient has already mentioned all of the reasons that he accuses himself of being lousy, being whatever. So the tension inside your patient's mind is high. He has already put different labels on himself. Now he's more ready to find the reason otherwise. So when you ask him, think about it. What else can you say against this? He would be able to talk about the other side. Something from his mind starts to define himself. So this is actually somehow natural. So when there is a negative or traumatic thought that you want to challenge with evidence technique, please always start with evidence for, starting with asking the patient all of the evidences or pieces of evidence that proves the thought is correct. That raises the tension inside the patient. And then when he starts talking about the other side, evidence against, he starts to argue against to feel better. And this is your moment to ask open questions. Okay, Sihi. On top of all of this, I have this question. You mentioned something about the physical in this side when you said that you felt that your physical incapability was your fault. Do you think the fact that you fought for your country and you got physical incapability could be your fault? Would the common sense say that physical incapability is something that you should be ashamed of?
Yeah.
Thank you.
No.
Thank you. Let's write it in the other side, the evidence against. So after you said, I left everything for my children and wife, There's another reason, that my physical incapability is the result of the fight and the war, which I'm not guilty for that. The other thing that you mentioned, Sehi, was your mental symptoms. You said I'm mentally disabled and incapable, and I should be ashamed of that in front of my parents. Is that correct? Okay. Were you mentally incapable before this war?
Ні, я був дуже
No.
успішним.
No, I was successful.
Mm,
I used to be successful.
mm. So you fought for your country, and because of these war traumas and because of all of that, now you're mentally incapable and damaged. Is that something that people should be ashamed of and should be criticized for? People who've been damaged in the field, traumatized, as you know, is the name.
Ні.
No. No.
Let me ask this question. If we ask this question from 1,000 wise people, if we ask the question that this guy, this man, has fought for his country honorably and has been damaged mentally in the war field, and now he's incapable, should he be criticized? Should he be ashamed for being mentally incapable because of that? What do you think those 1,000 people would say?
Що ні, таку людину не можна засуджувати.
No.
Вона в тому не винна.
You can't judge. It's not their fault.
As you can see, the common sense would vote that your mental incapability is not necessarily your fault. How about writing it down in the other side, evidence against, that my mental incapability is not my fault, it's related to war and trauma. Okay, we talked about your job, but about your wife. Your wife, the fact that your wife has avoided from you and has prohibited you to see the children, it means that he doesn't like you anymore? Is that what you think? Or is that what she says?
А коли перед розлученням
When, before the divorce, we sat down and talked. We came to the conclusion that for the child, it would be better for me to live alone, to live separately from them.
Mm-hmm. Did you conclude that if one day you get better and you improve, things would be different? and you can see your children.
Мене на початку відкинули повністю.
Well, initially, my family rejected me totally, but now, my son calls me sometimes, every now and then, and we talk over the phone. He hides it from his mother, but still, he does call me, and this is my achievement.
Therefore, you're saying that the fact that you haven't been able to see your children was related to your specific situation as a traumatized patient, not related to your personality. Is that correct? Okay.
Yes, that's it.
And can a person be ashamed of his situation as having a mental illness?
Не мусить, але все одно соромно від того.
Well, no, they mustn't be ashamed, but they still are.
Yes. The feeling is there, but what I'm asking is about the rationality. So rationally, mental illness is something related to the brain's disorder. Should we be ashamed of a disorder that we didn't start in our brain?
Логічно, звичайно, що ні.
Well, logic tells us that it shouldn't be the case, right?
Mm-hmm.
But I know what I was like.
Yeah. So,
and
as far as
I really regret the fact that I ended up in this situation.
Yes, it is quite disturbing, but we're talking about logics here. Would you agree that right now it is our duty to focus on the logics? You've lived with your emotional reasonings enough. Now it's time to think about the rationales. Wouldn't you agree?
Так треба.
Yes, I do agree.
Okay.
This is the way it should be done.
Okay. What I did about this specific item, so understandably, when it came to the logical thinking about a mental illness, he showed some levels of resistance. Here, I tried to pinpoint the specific type of cognitive distortions that he has. As you can see, the cognitive distortion that he has is emotional reasoning. So he thinks this is my fault because I feel guilty. So the way he feels is the reason to prove that the feeling is correct. This is the textbook definition of emotional reasoning. What I did was to illustrate that. Okay, so you feel that? That means it's correct? Okay, this is emotional. I went back to the therapeutic contract. So the therapeutic contract for him is that when he steps in your office, he's already accepting that this is enough. I want to live differently. And you can always use that contract, that understanding, the mutual understanding between you and your patients. The understanding is, okay, you agreed that you have lived enough with your negative emotions and you want to know the logics of things. So don't you think that logics are important? And this is where you can always get your patients' agreements. And you can bypass the resistance based on pinpointing the cognitive error. So let's go back to the role play. Okay, Sihi, so let's write down that mental, the fact that I agreed with this arrangement was because of the mental illness, not because of my personality. Is that correct? So inside this technique, I actually used another technique, separating situations from the person's personality. Patients are always tending to consider behaviors, specifically when they are talking about themselves, they are tending to assume that their behaviors, their negative behaviors or dysfunctional behaviors are related to their personalities. Such as, because I left my, for example, family, I'm a bad father. So here, I helped him to understand that a behavior is not related to his personality. He said he concluded with his ex-wife that this was better for everybody for the moment. I reminded him that this was a behavior not related to his personality. This is a technique that you can use either separately or inside this evidence technique as part of the evidence. Okay, now see, let's evaluate which part is more powerful. In order to understand which part is more powerful, we have a scoring system of 1 to 10 for each one of these factors. Now, when we talk about each one of them, you give a score out of 10 to each factor, depending on how much you think it is logical, the magnitude of its logical concepts would give you the sense to give. So for example, for the first evidence for example, you said that because I'm physically incapable, I should be ashamed of myself. Logically, how much does it make sense from 1 to 10? If it has the highest amount of logics, it's 10. If lowest, 1. How much?
Один.
1.
1. Okay. The second one was, you said, because mentally I'm incapable, I should be ashamed of myself. How much is the score of this one, logically?
Так само 1.
Again, 1.
Okay. Then you said, because I'm jobless, I should be ashamed of myself and it's my fault. How much is logically, how much is the score of this one? As you can see, each time I repeat logically, because it's important to mention to patient that we are not talking about emotional reasoning. We're talking about logical reasoning. So how much is the score for this one?
Ну, тут 5, мабуть.
Well, here I would say I would rate it 5.
Okay. One more thing. Please don't bargain with your patients about their score. Let them give their score. If you do your job professionally, it doesn't matter whatever they give the score to. Okay, and the last one. My wife rejected me because I was cynical and abrupted, and that means that I should be ashamed of myself and this is my fault. How much is the score of this one?
Якось воно мені так на 4 на 5.
Well, I would rate it between 4 and 5.
Well, because we don't have decimal here, unfortunately. Can you give 4 or 5, whatever you think is closer?
П'ять.
5 then.
Okay, 5. Now let's go to the other side. All of the reasons against this statement. First, you mentioned, during my sleep, I do so many things involuntarily. It's not my fault doing those things. Between 1 and 10, how much is the score of this one? Arguing that you shouldn't be ashamed of yourself.
Ну,
That
тут
means
10.
how much?
10. 10.
10.
Okay, 10. And also the second one, you said I fought for my country honorably, and I shouldn't be ashamed of being a fighter. What's the score of this one?
Десять.
10.
Okay, write down 10. The other one was, I'm not scared of having a job, and I have been looking for a job. Unfortunately, so far I haven't been successful, even though I have a search for a job. And that shows that I shouldn't be ashamed of myself. How much is the score for this one?
Також 10.
Again, 10.
Okay. And then you said, I left everything for my children and ex-wife. Therefore, I shouldn't be ashamed of myself. I'm not guilty. What's the score of this one?
Десять.
10.
Okay. And next one, if I'm physically incapable, this is not my fault to be ashamed of. How much is the score for this one, showing that you shouldn't be ashamed?
Перше, що прийшло 8.
8.
Okay. Next one, the fact that I'm mentally incapable, mentally damaged due to this war. That means I'm not ashamed. I shouldn't be ashamed. It's not my fault that during the war I'm mentally damaged. How much is the score for this one?
Дев'ять.
9.
Okay. And the last one, you mentioned something about your personality before all of this. That shows that your behaviors being abrupt and threatening was not your personality. These were behaviors related to your damages. Therefore, you shouldn't be ashamed because this is not your personality. How much is the score for this one?
Сім.
7.
Okay.
7.
Now let's see what's the total score on each side. Evidence 4, as far as I can see, can you do that for me? It's interesting for me to know. Always let the patient do that.
В другій колонці в мене виходить 53, а в першій
Well, in the second column, we have 53, and in the first one, 17.
Sorry, what I have here is 64 because it's 10, 10, 10, 10, which means 40, then 8, then 9, then 7, which means 64.
бо я не все записував, то так. Не скрізь собі ставив позначку.
Well, I didn't note everything down, sorry.
Yeah,
I don't
that's
know
fine.
if I probably failed to jot down
yeah.
some
64,
of the
and
ratings.
the evidence 4 was 1155, which means 12. Anyway, in the sessions, you would ask your patients to write down everything and ask the patients to calculate. It is important for their minds to illustrate everything. This type of a scoring system, which is very, very standard, you can find using this technique in the book from Judith Beck, Cognitive Behavior Therapy, Basics and Beyond, exactly like that. So it's very classic. This is very, very illustrative to show the patients the magnitude of both sides. Now let's go back to the role play. So see here, what does it say to us? Evidence against is more than 5 times than evidence for. What does it say?
Що насправді ті причини, що я себе звинувачую, що вони Так, вони є, але вони
Well, the fact that in reality,
малий.
the reasons to blame myself, well, there are some reasons, but they are, let's say, less important than those which support the idea that it's not my fault, that I shouldn't actually be ashamed.
Thank you. Can I ask you to write it down, Sehi? Always ask the patient to write down the final conclusion after using evidence technique. And can you tell me, based on what we discussed here, how much do you believe in this one? The percentage of your belief in this conclusion, that is the fact that I'm incapable doesn't mean that I should be ashamed or it's not my fault. How much do you believe in this final conclusion that's it's not my fault? Percentage wise.
Ну, правдиве на 10. Ну, якщо від 0 до 10, то 10.
10.
So you are saying,
Ну, якщо від 1 до 100%, то це, ну, це на 100% так.
100% true.
100%. So let's write it down, 100%. Thank you. So, Sihi, I want to ask you what happened today. Today, first, you started by immense feeling of incapability and feeling guilt and shame. And then when we discussed all of the matters, at the end, you felt that it was not your guilt. You shouldn't have been ashamed of yourself. And you're certain 100% that the shame and guilt should not be there logically. What does it say to you?
Воно так виглядає, ніби як полегшення. Так як ніби якийсь вантаж.
It looks like relief. You know, this burden has been lifted from me.
Okay. So thank you for this case. I want to conclude what I did during this session. I was presented with a fairly new case. So before starting challenging any negative automatic thought, we needed to extract some of them. We extracted some of them. We pinpointed one of them, the one that was related to shame and guilt. And it is understandably one of the most important parts of trauma patients. As I mentioned, they always, or nearly always, end up criticizing themselves for what happened. And frequently, this is not reasonable. This is one of the cognitive errors. We call it personalizing. That means no matter what happens, I'm guilty. They have this tendency to always pinpoint everything on themselves. Now, with knowing that, I extracted the exact concept that because I am incapable, I should be ashamed and guilty. Then I asked the patient to write down evidence for evidence technique. And before that, I used two other techniques. I used semantic analysis, or defining the terms. So whatever that your patient is saying, always please elaborate on the definition of that, because for each and every person, the meaning of the words like self-confidence or shame and guilt would be different. So I use that. Then after that, I use another one, downward arrow, to find the ultimate reason that sense and feeling was very important for the patient. So what is the bottom line? What is insight? What does it mean? Going to the actual meaning, bad or negative meaning for the patients. After I found all of this, now I use evidence technique. First, evidence to prove that negative thought, because you can ask the patient to ventilate whatever he or she thinks about accusing himself, proving that. Now, the patient is very distressed by accusing himself. This is the moment to go to evidence against, asking open questions of the patient, asking the patient to think. And at the end, you can use evidence for to create evidence against. As you can see, at first, we didn't have that much, but for each and every one of the evidence for in this column, after I asked, for example, is it your fault that you have physical incapability? No. So there was another response in the other side. The physical, the mental, the job, for each one of them, we created one. And now, after you are sure that you have covered all of the aspects of evidence against, this is the time to give the score. As you can see, automatically it happens. And I can reassure what my colleague did here with regards to scoring is exactly the same thing that would happen with the real patients. So she didn't compromise on anything. That's exactly what happens in the field. When you enable the patient to see all of the aspects, almost invariably, patients would see how much their judgments had been illogical. And when they emphasize on their emotions, you can have the opportunity to pinpoint the possibility that they have emotional reasoning. In this session, we didn't have any time to elaborate more cognitive distortions. In order to use eliciting different types of cognitive distortions as a technique, you need to have a different or separate session with the patient to explain all of the important cognitive distortions with the patients, the definitions. Then in the other sessions, you're always able to refer back to those cognitive distortions and help the patients to recognize them inside all of these other techniques. A very good list of all of the cognitive distortions can be found in my senior colleague, Professor Robert Leahy, who is actually the person who organized all of this, these lectures from Academy of Cognitive Behavior Therapy. He has a great book, like most of his books, cognitive therapy techniques, there's a good list of all of the 17 different cognitive distortions. I invite all of the colleagues to read that book, and also specifically those cognitive errors. This list needs to be discussed with your patients in a separate session. And after they acknowledge the meaning of all of this, during the other sessions, you can always find these errors and mention. So every now and then, for example, you can, in that session, emotional reasoning or personalizing or labeling, different types of cognitive distortions could be seen here. Anyway, we've run out of time. We had a limited time. I tried to go through some of the techniques. You can see when you use the technique skillfully, you can change everything. This patient came to the session. He was very certain that he should have been ashamed of himself. But at the end, he concluded that it was totally unreasonable. This is how you can use cognitive therapy techniques. Believe me, it's always possible. Thank you. I'm open to any questions if somebody has any questions.
Wow, Babak, bardzo, bardzo dziękujemy.
Thank you very much, Babak. This has been very methodical. What we did is guiding us through the whole structure of working with thoughts around trauma. But also, I would like to thank Sophia very much. Thank you. Thank you for this. This has been a very moving, I believe, for all of us, a very moving example. And yes, as Babak said, a very complex example of trauma here. And well, thank you for these clinical comments also that would emerge as we went on, because for us professionals, this has definitely provided a great prompt well, sadly, our time is over because we would like to hear more, and we have words of thanks, as far as I can understand, in Ukrainian. But we have the chat is full of words of thanks. Unfortunately, there is no time for a Q&A session, but I wanted to assure you, because there are some questions about the recording, so you can, I guess that playing it back will be of help to professionals. So in Ukrainian, please give us a while. We will prepare it, and you will have access to all these recordings on our platform. So we will be talking about, we'll be amplifying this on Facebook, and definitely you will get some info on when the recordings will be available. So thank you very much. Thank you for this fruitful morning, because it's still morning here in Poland and in Ukraine, for that matter. So there is still a lot to do. We could expand this. We could go more in depth, definitely, with regard to many elements. But we have to pause here. So many thanks for letting us on, actually, on your workshop, on your methodology.
I tried my best to show just a glimpse of how we can use the techniques. As you said, this is an ocean of different concepts about how you accommodate the trauma techniques to address the trauma patients. But well, this is an introduction to the cognitive behavior therapy of trauma, but I'm sure that there would be other lectures very helpful for all of our colleagues. Thank you, and thank you, Sophia, and thank you, Anna, for this opportunity. It's been a pleasure.
My również dziękujemy. Może pani Sofia chciałaby jeszcze coś
Yes,
powiedzieć?
thank you. Maybe Sophia would like to add anything.
Я також хочу подякувати за таку
Yes, I also wanted to thank for this opportunity. For me, it's also a huge opportunity. It was very interesting, you know, looking at this, observing a professional at work, you know, a pro, and actually being able to role play this patient and speak on the patient's behalf. That's extremely valuable as an experience. So thank you very much.
Thank you.
Yes, so thank you. And it's great that we can be of help, at least in this way. So we do invite you to attend further seminars, further sessions. We're meeting back here on Tuesday at 6 p.m. and we'll be very happy to have you at our meetings. Babak, we know that you're in Australia, but hopefully we'll be able to meet you face to face here in Poland offline, and you please feel invited already at this point. Please come to Warsaw, visit us. We'll be very happy to have you.
Thank you. It would be my pleasure. One of these days I should come to Warsaw. I'm very curious to know there, but at the same time, as I said, I'm always available for more online sessions. If there's any possibility, I would welcome any invitation for these sessions like this. Good luck.
And they say that you're invited to Lviv, the chat says. We will take this into account. Yes, exactly. You're invited to come to Lviv, also, not only to Warsaw. So please come to this part of the world in any case.
Okay, I will. I'm more than happy to do that.
So thank you. Have a nice day, everyone. And
Thank
well,
you.
bye-bye.